Welcome to MD Labs Specimen Collection video. This video illustrates proper procedures for collection, requisitions, packaging, and transporting urine and swab specimens to MD Labs for UTI, STI, and UA analysis. The supplies you need for proper specimen collection and transport include a gray top vacutainer for UTI specimens, a red-yellow top vacutainer for UA, and for STIs, both a yellow top vacutainer and a green e-swab. Your offices can choose to use either a standard collection cup with a transfer straw or use a port cup, which has a pin built into the lid of the collection cup. Depending on how you will be submitting the requisition to MD Labs, you will need to have the appropriate requisition supplies. The preferred method for submitting a requisition is using pre-printed, account-specific, barcoded UTI, STI, UA requisition stickers. This is the simplest method for submitting a requisition. An alternative method is using the UTI, STI, UA requisition form with stickers at the bottom. And the third method is by using the eRec system via the MD Labs portal with a label printer. The other supplies you will need for safe and proper specimen collection and transport include gloves, safety glasses, plastic biohazard bag with absorbent pad, UPS or FedEx lab pack with a pre-affixed MD Labs return label. All of these items are provided free of charge by MD Labs. When handling urine specimens, you must follow standard guidelines and universal precautions for working with biohazardous materials. Use personal protective equipment, including gloves, eye protection, and a coat or gown to prevent exposure to blood-borne pathogens or other potentially infectious materials. When collecting urine, provide the patient with a sterile, sealed urine collection cup, labeled with their name and date of birth. Provide the following verbal instructions to the patient on how to collect a urine specimen. Go into the washroom and wash your hands with soap and warm water. Dry your hands with a paper towel. Remove the lid from the collection cup by unscrewing it counterclockwise. UTI and UA specimen collection requires a midstream clean catch. Instruct the patient to first pass a small amount of urine into the toilet before passing urine into the collection cup. They must fill the cup until it is at least 1/4 full. STI specimen collection requires a first catch. Instruct the patient to pass their first voided urine directly into the collection cup. They must fill the cup until it is at least 1/4 full. If you are collecting both a UTI or UA and an STI specimen from the same patient, provide the patient with 2 collection cups, clearly marked first and second. Inform the patient they will be passing urine into both collection cups. To pass their first voided urine into the first collection cup, filling it 1/4 full, and then passing urine into the second collection cup, filling it at least 1/4 full. Screw the lid back onto each collection cup until it clicks, and wash your hands with soap and water. Demonstrate to the patient how to properly close the lid of the collection cup by screwing the lid until it clicks. Then, direct the patient to the bathroom and instruct them to return the collection cup to you when they are done. You will now transfer the urine to the vacutainer. If you are using a standard collection cup, insert the tip of the transfer straw into the urine specimen cup, making sure the tip is completely submerged. Push the correct colored vacutainer down and into the top of the transfer straw, holding it in position until the flow stops. Remove the vacutainer, leaving the straw in the cup. If you are using a port cup with the pin built into the lid of the collection cup, pull the sticker back from the lid, exposing the port opening. Push the vacutainer down and into the port opening, holding it in position until the flow stops. Remove the vacutainer. Check to make sure the urine reaches the minimum fill line noted on the vacutainer. If not, you will need to collect more urine from the patient. If there is enough urine, you will now enter information on either the pre-printed sticker on which you will write the collection date and time using a 24-hour format, or the sticker located at the bottom of the printed requisition form on which you will write the collection date and time using a 24-hour format and the patient's initials. Then place the sticker on the vacutainer and press down to secure the sticker to the vacutainer. If this sticker is not affixed, the specimen may not be processable. You can now safely and appropriately dispose of the remaining urine, collection cup, and transfer straw, if one was used. Dispose of sharps on site. Do not ship them to the lab. If the office is using an e-swab for STI specimen collection, an office staff member will be collecting the specimen and providing it to you. You can supply them with the printed e-swab collection instructions from MD Labs. After the office staff member provides you with the capped e-swab tube, write the collection date and time using a 24-hour format on the sticker. Then place the sticker on the side of the tube. UTI and UA specimens must be received by the lab within 48 hours of collection. This means you must ship UTI and UA specimens overnight delivery to the lab the same day it is collected. Otherwise, the lab may not be able to process the specimen, and you will need to collect a fresh specimen from the patient. If the specimen cannot be shipped the same day, it can be stored overnight in a sealed plastic bag in the fridge at around 4 degrees Celsius. Do not store it for longer than 24 hours. The bacteria in the urine sample can multiply if it is not kept in a fridge. If this happens, it could affect the test results and will not be processed by the lab. You are now ready to complete the requisition. The preferred and easiest method is using the pre-printed account-specific bar-coded UTI, STI, UA requisition stickers. On the large sticker labeled Affixed to Printed Order, check the box if the specimen was collected from a catheter. Enter the collection date and time and your initials, then affix this sticker to the printed lab order that came from the EMR/EHR system. Check to make sure the lab order includes patient demographics, insurance information, test being ordered, diagnostic codes, appropriate clinical notes, appropriate risk note. If the patient demographics information is not included on the lab order, you will need to have the patient's face sheet printed from the EMR/EHR system to submit with the specimen. If the insurance information is not on the lab order and not on the face sheet, you will need to make a copy of the patient's ID and insurance card to also submit with the specimen. If you are using a printed requisition form, make sure all the sections are filled out accurately and completely. All of this information is required in order to ensure the lab performs the right tests for the right patient, is able to provide all requested data to the provider, and is able to bill properly. If any of this information is missing, you will have to painstakingly find and provide this information later. Start by circling the name of the requesting provider that is pre-printed at the top of the form. If there is no name pre-printed, then handwrite the provider's name and NPI number. Then enter all the information in the Patient and Collection Information section: patient name, date of birth, sex, male or female. Check if this is a catheter patient, and then add any notes if there is information you need to share with the lab. Then enter the collector's name, the collection date, and the collection time, using the 24-hour clock format to record the time. Thus, 2 p.m. would be designated as 1400, and 3:30 p.m. would be designated as 1530. If in-office dipstick test results are available, check the appropriate boxes on the requisition form. Then you will designate the lab tests to be completed. For a UTI specimen, depending on what pathogens are being tested, either check the box next to UTI complete, UTI pathogens, sexually transmitted bacteria, or specific pathogens to be tested. For a UA, check the box next to UA Complete. For a sexually transmitted infection specimen, either check STI Complete, the first group of STI pathogens, the second group of STI pathogens, or specific pathogens to be tested. You will then enter the associated ICD-10 diagnostic codes. A list of commonly used ICD-10 codes is printed on the back side of the requisition form. If the provider's signature is on file, the provider does not need to sign the form. However, if their signature is not on file, then the provider needs to sign and date the form. The form is now complete. If you are using the e-requisition form, you first need to log into the provider's secure portal at mdlabs.safemedicaldata.com. To enter a requisition for a new patient, you click the Requisition Entry tab. Click New Requisition, choose the requesting physician, choose the collector's name, click New Patient, enter the patient demographics, and the insurance information. You then need to specify the specimens received by clicking the down arrow and selecting Molecular Testing. The screen should refresh and change from the toxicology diagnostic codes to the UTI/STI test codes. However, if the screen does not refresh, you then need to hit the Enter key to refresh the screen to see the UTI/STI test codes. If the test codes area is blank, or the test code you are looking for is not shown, click the magnifying glass next to Diagnostic Codes, uncheck Common, and click Find. Then, select the desired test codes and click Submit Selection. Those test codes will now appear in the test code area. If the provider is ordering a UTI test, you must select at least one UTI symptom. You will notice the diagnosis code is listed next to the symptom. If the provider is ordering an STI test, you must select at least one STI symptom. If there is anything you need to communicate to the lab regarding the test or the diagnosis code, you can enter that information in the appropriate box. You will then upload any documents, such as the lab order, patient face sheet, or insurance card, by clicking the Browse File button, finding and clicking on the file, and then clicking the Upload Now button. If a patient consent to testing and use of results financial and insurance authorization form is needed, click on Print Signature Form and have the patient sign the form, which can then be scanned and uploaded or included with the specimen being shipped to the lab. Once everything is complete, click Submit and Print Label, and a window opens with a depiction of the label to be printed. Click on the printer icon. Change the destination to the label printer. Change the paper size to 2.4 inches, then click Print. If you are entering a requisition for an existing patient, you click the Requisition Entry tab. Click New Requisition, then click the magnifying glass to search for the existing patient. Once you find the patient, click Select to the left of the patient's name. You then complete the rest of the fields and print the label in the same manner. Now that the specimen is collected, the requisition is completed, and you have all the needed forms with the required information, including patient demographics and insurance information, you are ready to pack up the specimen for shipment to the lab. Depending on your situation, these forms could include the lab order, the patient face sheet, a copy of the patient ID, and insurance card. If you are using the preferred method of the requisition stickers, you simply fold up all the forms, place them in the outer pouch of the biohazard bag, then place the specimen inside the biohazard bag and seal the bag. It is important that the paperwork be placed in a separate compartment from the specimen to protect the paperwork in case the specimen leaks. If you are using the printed requisition form, Follow the same procedures, except you also include the top copy of the requisition form and place it, along with a patient face sheet, including their identification and insurance information, in the outer pouch of the biohazard bag, separated from the specimen. If you enter the requisition using the eRec system through the portal, then you simply fold up all the forms, place them in the outer pouch of the biohazard bag, then place the specimen inside the biohazard bag so it is separated from the paperwork, and seal the bag. All the biohazard bags containing the specimens in the zip-locked section with the paperwork in the outer pouch from that day's collection are then placed in the UPS or FedEx lab pack for transport to the laboratory. Place as many specimens as will fit into the UPS or FedEx lab pack before shipping. Sending a single specimen at a time, while sometimes unavoidable, creates excessive shipping costs. Lab packs can be dropped at any UPS or FedEx location or drop box, or scheduled pickups can be arranged by calling UPS or FedEx. You can contact the lab to arrange regular pickups. For UTI, within 24 hours of receipt of the specimen at the laboratory, the ordering provider will receive preliminary and not detected results. And if a pathogen is detected, final results are reported within 36 hours of receipt of the specimen at the laboratory. Results are delivered either by fax, a secure link with their electronic medical records from MD Labs, or by going to mdlabs.safemedicaldata.com and logging into their secure portal. Reports are typically one page and feature the following: patient information, requesting provider, information on when the sample was collected and processed, results from the tests performed. MD Labs reports are designed to present the important information first. As such, the top section reports whether a pathogen was detected or not detected, and if so, the pathogen or pathogens present with associated colony count, the methodology in which the pathogen was detected, and any significant findings, such as a MRSA or VRE. If anything about the specimen is otherwise remarkable, that information will be included in the Notes from the Laboratory section. The final report, which is simply labeled Lab Results, identifies any common sensitive antimicrobials if more than one pathogen was detected. If there are no common sensitive antimicrobials, then this area is left blank. Specific antimicrobial sensitivities by pathogen are then identified with their minimum inhibitory concentration, MIC levels, and whether that antimicrobial is considered resistant or sensitive to that pathogen for that patient, based on actual susceptibility testing. Below that, the report lists the patient's reported symptoms that were submitted on the requisition, along with a summary of unremarkable findings. MD Labs has an infectious disease specialist available for providers who might have questions or complex cases for which they would like to consult. If you have questions about the report, please contact the laboratory. Thank you for watching this training session on specimen collection and transport. If you have any questions, please email clientservices@mdlabs.com or call 775-391-5221. When results count, count on MD Labs.